Hello, I'm Sheree Stewart, a registered nurse with River Valley Area Agency on Aging. I will be sharing best practice tips for medication management, and it will include taking medications as directed, storing medications safely, and keeping track of multiple medications. It is very important to take medications as directed by your doctor. Ensure your doctor or pharmacist has provided clear instructions. Medications are prescribed for different reasons. Some are for chronic health conditions such as diabetes and heart disease, and others may be for an acute infection or a symptom such as a cough. Over-the-counter medications are used to relieve various symptoms such as mild pain and aches, gas, and itching. Supplements are taken for nutritional deficiencies. It is important to take all medications and supplements, whether prescribed or over the counter, as directed, to allow for best chances at effective and therapeutic results of your medical conditions and symptoms. According to the FDA, sticking to your medication routine means taking your medications as prescribed, the right dose at the right time, in the right way and frequency. The consequences of not taking medications as directed could lead to medical conditions worsening, medical emergencies, hospitalizations, and even death. Follow instructions to obtain effective therapeutic results. If there are any questions or uncomfortable side effects, contact your doctor. Do not just stop taking your medications. Your doctor may adjust the dose, change your medications, or prescribe something for a side effect. Sometimes questions and concerns come up about a medication after your doctor's office has closed. Ask for your doctor's after hours phone number and keep it handy. To help remember to take your medications or give medications to someone else, consider using pill planners or boxes with days of the week to help you. Use alerts to remind you also, such as mobile phones and print calendars. Take medications at the same time each day to help remember, such as morning meds right after breakfast, afternoon medications after lunch or midday news, and evening medicines after 6 o'clock news. Storing medications safely. Follow medication packets for storing your medications. Heat, air, light, and moisture can damage medications. That's why the bathroom medicine cabinet is not a good storage place due to the heat and moisture from showers, baths, and the sink. A cool, dry place is best unless the instructions state otherwise. Good storage places include a dresser drawer, a shelf, a storage box, closet, or a kitchen cabinet that's away from the stove, sink, and any hot appliance. Keep medications in their original containers to ensure proper identification. Store medications out of reach and sight of children. Be mindful of your grandchildren. According to the CDC, about 60,000 young children end up in the emergency room each year because they got into medications when adults were not looking. Prescription pain medications are being stolen in part due to the opioid epidemic. Safely secure pain medications to help avoid theft and interruption in your pain management. It will not be easy to get a prescription refill earlier or a replacement refill, even with a police report of theft. Examples of prescription pain medications include hydrocodone, Vicodin, Percocet, OxyContin, morphine, codeine, and fentanyl. Store refrigerated medications at the right temperature. Store at the recommended temperature range on the medication packet. Use a thermometer and check periodically, such as weekly or monthly, to ensure the correct temperature is being maintained. Keeping track of multiple medications. On average, people between the ages of 55 and 64 take 1 to 4 prescriptions according to the American Society on Aging. It is very important to keep track of multiple medications. Keep medications in the same place if possible. If you have multiple bottles of the same medication, keep only one bottle in use at a time. Keep a medication list updated and handy to quickly refer to if needed. The list should include the name of the prescribed or over-the-counter medication, dose, reason, and frequency. Dispose of medication that is no longer needed or expired to avoid taking it by mistake. Check bottles routinely for expired medications, weekly, monthly, or whatever schedule works best for you. Drug disposal options. Do you have medications you want to get rid of? Here are 3 options. Some communities have a drug take-back option for its residents to drop off medications for safe disposal. Check the U.S. Drug Enforcement Administration's website and your local drugstore and police station to inquire about this option. A second option is to flush medications in your toilet. Please note, use this option if the medication label directs this, or the U.S. Food and Drug Administration, also known as FDA, or your local law permits this. The FDA has a list of medications approved for flushing on its website. The third option is the FDA's instructions for disposing of medications in your household trash. This information is also available on its website. Here's how. Remove medications from original containers and mix with something undesirable, such as coffee grounds, cat litter, or dirt. This makes the medication less appealing to children and pets and unrecognizable to someone who might go through the trash looking for medications. Put the mixture in a container you can close, such as a resealable storage bag or empty can, to prevent the mixture from leaking or spilling out. Then throw the container in the garbage. Remember to remove or scratch out all your personal information from pill bottles or packets before disposing of them. Here are links to information for safe medication disposal. This concludes the presentation, and thank you.